Are you at home suffering from low back pain? We're here to help you out today. I'm Chris. I'm a certified athletic trainer.
And I'm Coach Zach, a sports and medical massage therapist.
Today we're here talking about low back pain. We've read all your comments, we've heard your concerns, and we're here to tackle and give you some expert advice on how you at home can help yourself get better. So first, I think it's good just to kind of talk about low back pain. I don't know how you see it in the clinic or what you've experienced, but low back pain is one of the most common things that I see as an athletic trainer, or even just when I'm talking to people in the streets, like, oh, my low back hurts. And where do you think low back pain comes from? Where would you say the majority of low back pain comes from?
Two things: a weak, deep core. That doesn't mean your six pack. A weak, deep core and tight and shortened hip flexors due to prolonged sitting. In my professional opinion, those two factors are what contribute to the majority of people's back pain in today's modern world. Now that's taking away all traumatic injuries, right? If you've actually hurt yourself deadlifting or hurt yourself in a car accident, that's different. But if you have back pain that is not from a specific injury, a weak, deep core and tightened, shortened hip flexors are the two main causes. What about you?
I agree with those two. I think me and Zach kind of go back and forth. We have two different perspectives on injuries. You know, we each have two different types of populations. In the population that I see a lot of weak glutes and also really tight hamstrings which help contribute to low back pain. I think it's different. So as a certified athletic trainer, I deal with a lot of students. And really what happens with students is, what are students doing all day from 8 a.m. till 3 p.m. They're literally just sitting in a desk for hours the whole day. So when they come see me after school and they're trying to do therapy and they're feeling this tightness in their back, it's, for me, I think I look at the hamstrings and the glutes a lot. But with any injury, there's so many different mechanisms, especially with the different populations that we deal with. Even in your day-to-day life, you gotta ask yourself, how many hours a day am I sitting? Or what am I doing throughout the day that could be giving me this low back pain? I also deal with a lot of people who are industrial athletes, people who are working, say, in a warehouse or on the side of a road, who might not be using the proper ergonomic techniques to lift up and aren't using their legs enough, and they're just tweaking their back. So I really think the answer to low back pain it has a lot to do with muscle weakness, tightness, and imbalances, and I think we can definitely agree on that.
So when it comes to sitting, right, we've all heard the term sitting is the new smoking. If you have back pain, it's mostly caused by sitting. Let's dive a little bit into that. What about sitting will create back pain? It has to do with a muscle called your iliopsoas, your hip flexor. We've all heard hip flexors. Basically, hip flexor is just the muscle that picks your leg up. The problem is that when you're sitting for so long during the day, you're in this shortened state. Right? So your hip flexor, your psoas, which connects from your lower spine all the way down to your leg, is in this shortened state for long periods of time. Then what happens with a lot of people, you sit, you go to get up, and it's like you need a second. It's like, oh, you gotta take a couple steps, and then you straighten out, and then you just feel it all in your low back. So what's going on there is, while you're sitting and those hip flexors are getting shortened, not even necessarily tight, there's a difference, and I'm not gonna get into the weeds, but actually shortened, then what's gonna happen is when you stand up, you're stuck in this position, you go to get up, and then what happens is, and Chris is gonna tackle this later, you're stuck in this anterior tilt because that's the way the hip flexor works. So now you're in this, and then there's a lot of compression on the low back. So when someone comes into the clinic and they have low back pain, I actually start by working the front of the body. I actually get into the psoas muscle, deep visceral work. So I'm getting my hands into their gut and relaxing that muscle. And almost 9 times out of 10, with someone with low back pain, when I find that psoas, it's like a rope. It's so tight, I get into specific trigger points and it goes right into their low back where they feel that pain. So for you at home with back pain that sit for 8 or however many hours a day, you want to lengthen the hip flexors, but also strengthen them, because just because a muscle is shortened doesn't mean that it's strong. Just because a muscle's tight doesn't mean that it's strong. So it's about lengthening the muscles, creating that length so then you're not stuck in that anterior pelvic tilt. Another big thing is to actually strengthen your deep core. Now, when people say core, what is most people's idea, right? Six pack. Oh, you got washboard abs, that's a strong core. I am not talking about your six pack. I'm talking about the deeper muscles, specifically your transverse abdominis. We have plenty of videos on this channel, videos that I've made talking specifically about this muscle and how to strengthen it. But when you deal with low back pain, just as an example, you're sitting for 8 hours a day. Not just your hip flexors are getting tight, but your posture will also begin to degenerate, right? You'll start to like collapse into your low back. Your deep core muscles are getting turned off. So whether you're a young athlete or an older elderly person, you need to strengthen your deep core using exercises like vacuums or other things to help strengthen the muscles that actually protect your spine so you don't feel that low back pain. That's the way that I would attack it. Lengthen, relax the psoas, the hip flexors, strengthen the deep core. And then after that, I would take a look at the hamstrings, the glutes. Glutes play a big role as well.
So what we're gonna do is we're gonna dive into a couple of quick and easy tips that you can do to help cure your back pain in 15 minutes or less. So what I'm gonna have Zach do, Zach is going to demonstrate for me. I'm just gonna have him lay on his back right here with his head up here, knees. We're gonna do knees nice and bent, perfect. So as I was talking before, I see a lot of hamstring tightness is a huge indicator when I see people with lower back pain. All right, so we're gonna start with a simple hamstring stretch. You're gonna be lying down. We're gonna do one leg at a time. What I want you to do is you're gonna find, see, I have a nice little band here. You could use just a towel, a rope, or anything you might have around the house. So what you're gonna do, we're gonna start with the right hamstring first. So we're gonna lower this left leg down nice and straight. This band is he's gonna grab both sides here. Wrap it around the toes. I always say, so where the band should be, it should be up on the balls of your feet, so we can go a little bit higher. Good, because we want to make sure we're also getting a little bit of a calf stretch too. So what he's going to do, he's going to straighten this leg out, really try to get this leg nice and straight, and we're going to hold it for 30 seconds. So it's going to be a 30-second hold on the right, and then a 30-second hold on the left. You're going to do that for 3 sets. So once you've completed 30 seconds on your first leg, you're gonna switch and we're gonna do the other side, 30 seconds. Make sure you're getting that deep stretch. You're gonna feel it up and down that back side of your leg from knee to glute area. So the rationale behind stretching out this hamstring is, me and Coach Zach are in agreement. A lot of it comes from how your pelvis is tilted forward or backwards. This is just gonna relieve some of that tension that you might be feeling in your pelvis that's causing your low back pain. So now what I'm gonna give you a simple exercise that I give almost all of my patients with low back pain. It has an awesome success rating, so I hope you give this a shot. This is called the posterior pelvic tilt. And what we're doing is we're trying to strengthen that tilting of your pelvis to alleviate some of that low back pain that you might be feeling. So I have Zach in a laying down position with his knees nice and bent. He's got his feet about a foot apart, nice and relaxed. Are you relaxed? He's relaxed. So remember, what we're trying to alleviate and remove pressure from that low back pain, you might have that little bit of an arch. So as you can see, I can get my hand under here, under Zach's back. You have this arch in your low back here, okay? Everybody does. Some people it's a little more drastic, some people it's more light. So really what we're gonna do for a posterior pelvic tilt is I'm gonna give him some special cues so that he's gonna get that back posterior rotation of his pelvis and really strengthen that deep core that we were talking about, and even some pelvic floor muscles and those abdominal muscles to get you feeling good. So what we're gonna do is we're gonna do a 10-second hold, 10-second relax, posterior pelvic tilt. And how it's gonna start is he's gonna feel my hand here on your back, and all I'm gonna have him do, I'm gonna have him flex his core muscle and try to one of the cues too is to try to bring your belly button down towards the ground and press your back down against the floor. Now, so he's gonna be flexing the abs and also squeezing the glutes too, is gonna give him that posterior pelvic tilt. So he's gonna hold that for 10 seconds. So you're gonna count a nice 1, 2 Mississippi, all the way to 10, and then relax for 10 seconds. And I do that for 5 minutes. So it's a 10-second contract, a 10-second relax for 5 minutes. All right, now I'm gonna have Zach tag in and give his 2 exercises to fix your low back pain.
So we talked about lengthening the hip flexors and strengthening the deep core. So I'm gonna show you 2 exercises that do those. So to lengthen the hip flexor, I'm gonna show you a very simple hip flexor stretch, which is a low lunge. So I'm gonna have Chris face that way so you can see it from the side with that right leg in front. So in the low lunge, there's a couple things. A lot of times people will be too short. Like if you're just too short and both legs are forming 90 degrees, you're not gonna be able to get into it. So I want that right leg to be a little further forward there. Now, if you deal with sensitive knees, it might be right for you to put a blanket or something soft under this back knee. Now, as Chris already showed you, the posterior pelvic tilt. I'll show you in standing just so you understand. What we were doing was, this is an anterior tilt, and then you're just tucking your tailbone and bringing it in. So we did this on laying down, now we're doing it upright. So tuck your tailbone, try to flatten your low back, tuck, 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 engage that deep core, and then I want you to lean into that front leg. So we're getting into this hip flexor. Leaning, do you feel a stretch there? The big thing that you don't want to do is lean forward. A lot of times people will lean their torso forward. That's taking the stretch out of the hip flexor, so you want to stay upright. You can even bring your hands to your knee and gently push up. Now, if you want even more of a stretch, you take, if this left leg is down, take this left arm up to the sky and then over towards the right. You feel that a little bit more?
Oh yeah.
Yeah. The breath is key here. So you want to be breathing into this side body. What we're doing is taking this muscle that's always so short, we're lengthening it, but what's going to relax it is the breath. So deep diaphragmatic breaths, I would hold this for 30 seconds to a minute. And then the way you get out of it is just as important. So slowly come out, don't be jerky or sudden, and relax. Again, if you need some support on that back knee, do it. And make sure, a lot of times, especially in yoga, go ahead and go into it as low as you can with an anterior tilt. So like really try to arch your back and get as low as you can. This is what people will do. So arch, yeah, like be bad with it. Chris is, that's all I got. So like here, he's tilting his tailbone so he can get really low. Don't do that. Tuck the tailbone, engage the deep core so you get more into the hip flexor. So that's the first one. Now we want to strengthen the deep core. I'll have you turn and face the camera. Transverse abdominis. I have a whole video on just this movement, this vacuum. So we've all seen bodybuilders get up on stage and do their vacuum pose where they suck their stomach in really far. This is gonna strengthen that deepest core muscle, the transverse abdominis. Again, when this muscle is weak, too much compression in the low back, so you wanna keep it strong. The way you do it is with a vacuum. So this is best if you're just beginning to do it on an empty stomach. So like first thing in the morning or after you haven't eaten. Full breath out. Keeping the breath out, I want you to try to bring your belly button in as far to your spine as possible. You see that? Good. Look at all that. Hold that for 10 to 20 seconds. When you relax, don't let it just pop out. Slowly control it as it comes out. Go ahead and do it facing that side so they can see it more from the side. So again, full breath out. And then suck it in, suck, 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 suck. Hold, you see how much further that is? 10 to 20 seconds, and then relax. I would do this every single day. I've had success with people with diastasis recti, where their abs are literally coming apart. I showed them this, a couple months later, they started feeling, oh my God, I haven't felt this way since I remember. This muscle is so crucial, but so neglected and overlooked. So if you're dealing with low back pain at home, you wanna do these 4 things. Lengthen and relax your hip flexors. Strengthen your deep core. Relax and lengthen the hamstrings and get your pelvis in a more posterior pelvic tilt so you're not walking around all anterior like a duck. So tuck the tail, engage the deep core. That'll help your low back pain. Anything else to add, Chris?
No, I think those 4 exercises are awesome. If you do those every day, you will feel better.
I'm Coach Zach with Coach Chris. We'll see you next time. Yeah.